Hi guys, welcome back. So for today's video, we're gonna talk about ECGs. So for today, I just want to go over the real basics of ECGs. I'm gonna talk about the placements of the electrodes, as well as the precordial leads and the limb leads. I'll briefly mention the contraindications, as well as the complications of getting an ECG done. I'm not going to talk about the interpretation of ECGs. I'll save that for the next video because that's going to take quite a while and I need to go to a lecture. So without further ado, let's get started. So an ECG, or an electrocardiogram, simply represents the electrical activity originating in the heart that's captured in the skin by the electrodes. So we could use this tool to assess cardiovascular function, as well as diagnose different cardiovascular diseases. So for example, ischemic heart disease, like an acute MI. We could also use it to diagnose heart blocks, arrhythmias. So for example, an atrial fibrillation. We could also use it to diagnose chamber enlargement, cardiac hypertrophy, also electrolyte imbalances. So there are different types of ECGs, but the most common one is the standard 12-lead ECG. There's a 15-lead and there's also an 18-lead ECG, which I'll probably mention at the later stages of this video if I have time. But the standard 12-lead ECG has 6 precordial leads, or the chest leads, and 6 limb leads. So the precordial leads, or the chest leads, are leads V1 to V6, or sometimes C1 to C6. The limb leads are leads 1, 2, 3, and AVF, AVR, and AVL. So to perform an ECG, which is very easy, all we need to do is to firstly get the ECG machine that we're going to use. And we ask the patient to lie supine with their head slightly elevated, just for their comfort. And then we ask them to expose their chest by removing any clothing, as well as exposing their limbs. If they're unable to do this, then we can help them do this. So once the chest and the limbs are exposed, what we need to do is we need to attach the electrodes in their appropriate places, which I'll talk to in a bit. If necessary, we may shave the areas, especially on the chest, that's very hairy, just to allow the secure placement of the electrodes onto the skin. And then after this, we need to ask the patient to remain still and relax their muscles if they can, and breathe normally. So once the patient is still, we can then, the ECG machine would prompt us to give patient details. And once prompted, we just enter the details that the ECG machine needs, and then we press the record button. After pressing the record button, it depends on the type of the ECG machine, but in the hospital where I worked in, they're all electronic, so they don't actually print out the ECG. They just send it directly to the patient records. But some older versions might actually give you a printout of the results. Now let's talk about the limb leads. So the limb leads are composed of the standard leads, so leads 1, 2, and 3. These are also called bipolar leads. And the augmented leads, so these are also called unipolar leads. So these are AVR, AVF, and AVL. So to set up the limb leads, we have 4 different electrodes that we need to attach onto the patient's body. So we have the right arm electrode, which can be placed either on the shoulder or on the forearm. We have the left arm electrode, so again, that can be placed on the shoulder or the forearm of the left arm. We have the right leg electrode. So this can be placed just anywhere below the knee or on the hip on the right side. And then we have it on the left side as well. So the left limb or left leg electrode has to be placed below the knee or on the hip on the left side. As I mentioned earlier, the standard limb leads 1, 2, and 3 are also called bipolar leads. And this is because they record the voltage difference between 2 different electrodes. So for instance, lead 1 records the voltage difference between the right arm and the left arm. Lead 2 records the voltage difference between the right arm and the left leg. And lead 3 records the voltage difference between the left arm and the left leg. The electrode placed on the right leg is called the neutral or the ground or the dummy electrode. The augmented leads, on the other hand, like leads AVF, AVR, and AVL, are termed unipolar leads. And this is because they only have one positive electrode as a reference against a combination of the other limb electrodes. These augmented leads are computed using the information that we get from the other limb leads. So all of the limb leads, the standard and the augmented leads, view the heart from the coronal plane. So leads 1, 2, and AVL looks at the lateral side of the heart. Leads 2, 3, and AVF looks at the inferior side of the heart, and AVR looks at the right side of the heart. In terms of remembering the colors of the 4 limb electrodes, I use ride your green bike. So red on the right arm, your yellow on the left arm, green on the left leg, and bike for black on the right leg. So moving on to the precordial leads. So the electrodes for these leads are placed directly on the chest. So we have leads V1 to V6. So just to show you quickly, lead V1 is placed on the 4th intercostal space. So just about here at the right sternal border. V2 is placed on the 4th intercostal space at the left sternal border. V3 is placed between V2 and V4. So we place V4 first actually before we place V3. So V4 is mid-clavicular 5th intercostal space on the left side. So it's going to be about here. And then V3 is placed between V4 and V2. So V3 would be about here. V5, so we have V4 here. V5 is on the same horizontal plane, but on the anterior axillary line. So just about that. V6 is on the same horizontal plane as V5 and V4, but it's going to be mid-axillary at the mid-axillary line. So just about that. So just to recap, V1, 4th intercostal space, right side, sternal border. V2, 4th intercostal space, left side, sternal border. V3 is between V2 and V4. V4, mid-clavicular, 5th intercostal space. V5, same horizontal plane, but anterior axillary line. V6, same horizontal plane, but mid-axillary line. When placing these electrodes on females and even males with generous breast tissue, what we need to do is we need to lift up the breast tissue and place the electrodes directly onto the chest wall. We don't place it on top of the breast tissue. So these precordial leads, they look at the heart in the transverse plane, in contrast with the limb leads that look at the heart in a frontal or coronal plane. So remembering the colors, I just say a stoplight goes red, yellow, green, blue skies in spring, brown leaves in autumn, and purple presents on Christmas. So red, yellow, green, blue, brown, purple. So as I mentioned earlier, we have a 15 lead and an 18 lead ECG as well. For a 15 lead ECG, we have additional leads, so leads V7, 8, and 9. For the additional 3 leads for a 15 lead ECG are placed on the back side of the patient, so they're placed posteriorly. V7 is placed on the same horizontal plane as V6 at the posterior axillary line. V8 is placed on the left side mid-scapula. V9 is placed on the left side paraspinal region. So now let's talk about the contraindications for an ECG. So these are all just relative contraindications, not absolute. So firstly, if we're worried that our equipment is malfunctioning. And secondly, if the patient is hypersensitive or is allergic to the adhesive that we use for the ECG electrodes. So in terms of complications, the most common one is misinterpretation. So errors in the interpretation of the ECG is largely due to the fact that the electrodes are placed incorrectly. That's why we really need to remember the correct placements of these electrodes. Secondly, This may cause skin damage, so the adhesive used on the electrodes might damage the skin, especially in elderly patients because they have really, really thin and fragile skin. So if we just need to be careful in pulling the electrodes, especially in these patients with really, really fragile skin, because if we break that skin, it risks getting infected. The third potential complication I can think of, which is very, very unlikely, is the potential electric shock that can be given to the patient. This may happen if the equipment is malfunctioning, if there's short wiring in the ECG device. But again, this is very, very unlikely. And the most modern ECG machines, they have a third ground wire to prevent this from happening. So let's briefly discuss how an ECG actually works. So it works by picking up the wave of depolarization or the electrical impulses originating from the heart on the electrodes that we place on the patient's skin. So the voltage difference is measured across two electrodes. So we have a positive and negative electrode. Let's use an example. So let's use lead 1 as an example. So if you remember, lead 1 records the potential difference between the right arm electrode and the left arm electrode. So the right arm electrode is the negative electrode and the left arm electrode is the positive electrode. Okay, so what happens is if the impulse travels to the positive electrode to the left arm, then that's going to be recorded as a positive deflection. But if the impulse travels against that direction, so if it travels to the negative electrode, towards the direction of the negative electrode, then that's going to be represented as a negative deflection.